This is the petrous part of the temporal bone, showing the apex. This part is the base, which is going to be attached to the squamous part. It is having a superior border, anterior border and a posterior border. I repeat, anterior border, superior border and a posterior border. And the surfaces are anterior surface bounded by anterior border and superior border, posterior surface bounded by superior border and posterior border, and there lies the inferior surface. Here lies the inferior surface. It is bounded by the posterior border and the anterior border. Now this is the anterior surface. What are the presenting features in the anterior surface? Here lies a depression most anteriorly close to the apex, which is for the lodgement of trigeminal ganglion. This is called trigeminal impression. Here is an elevated portion behind, which is known as arcuate eminence, for the lodgement of the superior semicircular canal below it. In between these two, there is a bony plate. This is known as tegmen tympani. This tegmen tympani is pierced by two foramina for the passage of greater and lesser petrosal nerves. Now this tegmen tympani takes a curve and it passes in between this fissure. What is this fissure known as? If you can see, this fissure lies between the squamous part of the temporal bone and this is the tympanic plate. So this is squamotympanic fissure. But when the tegmen tympani enters in between them, this squamotympanic fissure is divided into squamopetrosal and petrotympanic fissure. This petrotympanic fissure gives passage to cauda tympani nerve, anterior tympanic branch of maxillary artery and anterior ligament of malleus. Now see, this is the posterior surface of the petrous temporal. This is the posterior surface and this is characterized by the presence of a very important foramen known as the internal acoustic meatus. This internal acoustic meatus gives passage to both roots, both sensory and motor root of facial nerve, vestibulocochlear nerve and internal auditory artery. Here lies behind a vestibular canaliculus, which is a very slit-like opening just behind and lateral to the internal acoustic meatus, and close to the superior border there is a depressed area known as subarcuate fossa. Subarcuate fossa. Further behind, if we reach the mastoid part, here we get a sulcus. This sulcus is for the lodgement of sigmoid sinus, so this is the sigmoid sulcus. And in the mastoid part we can also get a foramen. This is mastoid foramen.